Welcome back, everybody, and welcome back to the Morning Blend from Florida Gulfstream Urology, Dr. Alejandro Miranda Sousa. Good morning. Glad to have you here.
Thank you, Bill.
Let's talk about vasectomies. What is a vasectomy?
Vasectomy is a surgical contraception, permanent contraception. It's done in the male, and what you actually are trying to do is achieve an ejaculate without any sperm. So you go back to the source, and the source will be the sperm is produced in the testicles. So what we do is we divide the tube that connects the testicles towards the prostate, and that is done in the office usually.
How long does it take?
Routinely between 15 to 30 minutes. It's painless. Nowadays we do have several techniques, but the one that we routinely use is a non-scalpel needleless vasectomy. So it's no scalpel and no needles. We use the anesthesia delivered with a spray. Obviously it's done with anesthesia for comfort. And through one single small opening in the scrotum, you can access the tubes that actually are bringing the sperm from each testicle. So there are two vases, one on each side. And with that we can divide it. We usually remove a segment of it and we cauterize it to be sure that the tubing will close and the scarring will help us get the sperm to the ejaculate.
You said permanent, so once a vasectomy is done, you can't reverse it, you can't go back and undo it?
We take extra time to be sure that the patients do not want to have more children.
Okay.
There are techniques to try to reverse a vasectomy, but they are not successful 100% of the cases. So obviously we discuss alternatives to vasectomy, because once we do vasectomy, it's very likely going to be permanent. There are some techniques, again, that will not be covered by insurance that you can actually use to reverse them. But again, based on the time from vasectomy to reversal versus the anatomy of the patient, might not be reversed completely. So you need to think very, very calm, discuss with your partner to be sure that that's what you want to do, because it's very likely going to be permanent.
In the hours and in the days and in the weeks and the months after the surgery, what can you expect?
So you might expect some soreness, maybe a little bruising in the skin after the vasectomy is performed. It's ideal to wear some jock straps or scrotal support for around a week to 2 weeks. It's better to take a couple of days off work. You can reassume your activity within a week. You can go back to work usually after the third day, but sexual activity, lifting heavy weights, those at least a week will be a good idea. Expecting, there's some small amount of complications, side effects from the procedure. Some include a little infection, but we try to minimize that giving antibiotics. We could have some discomfort that is usually not very severe, and sometimes a Tylenol will be enough to actually have the pain under control. And the other thing that you can experience is sometimes a little cramps, a little discomfort in your testicles that could ease up over several weeks afterwards.
You say the effectiveness is 99.85%.
Yeah, it is
pretty darn effective.
It is the most effective contraception there is. If you compare that to some other form of contraception, like condoms, for example, the failure is 2 to 3%. So this is much, much more effective, and it's permanent. And if you add the price of contraception, the price of pills and condoms and spermicides and things like that, over time, the cost of vasectomy is much more cost-effective or much more reasonable.
That's one of the advantages. There are disadvantages to vasectomies that you'd like to point out in conversations you have with your patients.
Well, the disadvantage is that if you are thinking on having a child, it's very likely it's not going to happen. One is the other one. It will be the cost that may be upfront, but most of insurance will cover it, and the potential of side effects. So it's extremely important that you talk to your partner and decide. Sometimes birth control pills might be used for several years, and when the woman grows older, those pills could have some side effects. So sometimes men take responsibility and decide to do this for their partners. So I think it's very easy comparing to what the alternative to continue using contraception and some other methods, even tubal ligation that requires general anesthesia most of the time.
I'll bet that when patients want to talk about vasectomies, or they're thinking, it's a conversation that you have with them and you discuss advantages, disadvantages, the befores, the after, and the what happens.
Correct. And the other thing that is important is if the vasectomy is decided to be done, vasectomy doesn't work immediately. It needs to follow a process to kind of clear the pipes, clear the system, it requires at least 20 ejaculations, and we usually say around 2 to 3 months to have it clear. So before you can stop contraception, it's better to check the semen for the presence of sperm. And the other thing that is extremely important, that having a vasectomy would not protect you from sexually transmitted diseases like HIV and
Those
syphilis.
precautions
and some more
remain.
things. Precautions remain, and for that, condoms will be the best method.
You are available at Florida Gulfstream Urology.
Yes.
Here's your address and phone number. We'll put that up there. People can call you and come to see you and talk to you.
Even if you have any questions, we'll be happy to answer them.
Thank you so much, Dr. Alejandro Miranda Sousa. Did I get it right?
Yes, you got it.
All right.
Thank you for
You
having
can
me.
get it right. Thank you so much. 21st Century Oncology, also Florida Gulfstream Urology. Information about all of that, just go to our website. That's fox4morningblend.com.
And one last check on today's Fox forecast.